the agenda and the
Minutes, yeah.
minutes. Okay.
This is the first, I've never seen this in all the years I've been here.
Oh, well,
All the years, I've
that's
got
why
3.5
we,
years.
that's why we had to get you in here the last time, remember?
Yeah.
Okay. So, and I don't see Jeannie for Mason Matters either, or Kim.
I
And I
don't think
thought-
Kim was going to come anymore. I thought
Well,
it was
I
just
know,
gonna be
but
Jeannie.
Jeannie should be here.
Maybe we should start clicking where they're going to be here. Of course, things come up at the last minute, so.
And we don't have a health officer's report, but.
But I've
we
got
could
stuff,
do it.
I've got things I
Okay,
can.
so
yeah.
let's just do that.
Okay.
Oh, I guess I gotta call the meeting to order first. At 3:35. And, oh, and maybe we better do introductions.
Randy Netherland, Mason County.
Peggy Van Busker, Hospital District 2, and Chair of the Board.
Kathy McDowell, Commissioner of Finance, City of Shelton.
Dave Wyndham, Director, Mason County Community Services.
Debbie Riley, Environmental Health Manager, Mason County Community Services.
Peter Allen.
Michael Weinbach, Mason County Journal.
And our recorder.
Julie Elmendorf.
I just realized I never see you anymore. I see
Okay,
her all the time.
so, since we do not have a quorum, and we will go right down to the
Look
health
at that, look at
officers.
that.
Good quorum.
They're coming from all directions.
Yeah, we said no action items and they all come through the door.
So, actually, you can sit here if you wish.
Yeah, have a soft one.
So we now have a quorum.
Sorry about that.
And Terry Jeffries has joined us.
Thanks a lot, we don't get to go get our nap.
Well, that Commissioner Jeffries never shows up for anything.
And Eileen, would you like to introduce yourself?
Hi, I'm Eileen Branscombe, Chief Operating Officer, Public Hospital District Number 1.
Okay. So I would entertain a motion for the approval of the agenda.
So moved.
Second.
All those in favor?
Aye.
So passed. And the minutes, we had a little bit of a change in what was sent out. Tim was not here and the meeting adjourned at 4:59 instead of 5:59, but other than that, I didn't see anything. Could I get a motion to pass that?
I will make a motion to pass that correction in the last month's minutes for July.
Second?
Second.
All those in favor?
Aye.
And I do not see Jeannie here today. So we'll move on to the health officer's report.
Okay, so the health officer is not here today, so I'm going to fill in sort of as the administrator for the health officer. In your packets, you had this piece, which is Foundational Public Health Systems Attachment 1. It's a rather in-depth piece, so it probably took some studying to go through it. Last week we met in Seattle, the steering committee met, and we took this document and distilled it to a two-pager. On this coming Sunday, let me back up a little bit. The meeting in Kent last week went very well. Part of what we were talking about is if you take all this foundational public health systems work we've been doing, and we talk about the ask, we're going to be asking for $25 million a year to stop the hemorrhaging, especially in our smallest health jurisdictions. We've got probably 4 or 5 that are on the verge of fiscal collapse. One of the problems is once you discontinue a program and you remove that person, well, that person is also not billing to other programs in the small jurisdictions where they may wear 8 hats, and it starts to spiral. So we've asked for some funding. We're going to be asking for funding from the legislature to go in and deal with some of these things like communicable disease, chronic disease, and restoring some of the programs such as tobacco programs, which we've lost since 2009 when all that money was swept into the general fund. So we're making a big ask, and the meeting in Seattle last week was to talk about how do we make that ask? And, you know, obviously, a legislator is not going to read this whole thing. Their staffer may read the whole thing. So how do you distill it down to a 1 or 2 page document? And I've got that right here. We talk, instead of saying foundational public health services, which is what it really is, but how do we say that in a more colloquial way? And we talk about modernizing the public health system, modernizing the governmental public health system as opposed to the overall public health system, which may include other partners like American Red Cross, Heart Association, other groups that also do public health type work. So I will pass these around. And it's just a kind of 1 page, or actually it's a 2 page distillation of the things we talked about. I would say some of the highlights for me of the meeting last week were that I was representing the small rural health jurisdictions. Patty Hayes from Seattle King County representing obviously King County, which is the big rural. They're 1/3 of the state of Washington as far as public health goes. I think we have 1,400 employees. They're at the same size as Department of Health. And we came to a meeting of the minds that if we don't support everybody, all public health in the state, there aren't enough pieces to fill the gaps. You know, if little places like Lincoln County and Garfield and Stoughton fail, there's nobody in that area that's going to pick up the pieces. You simply, you know, Spokane can't cover that. Yakima can't, you know, the larger places simply don't have people on the ground to cover it. So we really have to concentrate on making sure the small rural health jurisdictions have enough funding to keep going, at least until we get into a more complete modernization and we look at how we fund the whole system rather than just individual counties. So we did agree on some funding principles in which if we get the $25 million ask or portions thereof, we may not get the whole $25 million. I'd love to get it, but I'm not planning on a $25 million bonus coming. So, but for whatever funding we get, how do we distribute that? And what we looked at was if you take the smallest health jurisdictions and fund them initially at 3 times per capita what we're funding the medium and large size health jurisdictions, it's enough money to fill the gaps and keep the lights on in the small jurisdictions. And we fall just like 0.2 of a percentage point above that. What does that mean for us? It would mean about a 90% increase in our state funding for Mason County. So there's
What's the state funding right now for Mason County?
we're running around $240,000 a year, $240,000 a year. So we would be adding another, say, $206,000 to that. 2.6 to 240 if we got the full $25 million ask, which would go a long ways into supporting some of those critical things like water quality.
Yes.
So this is a culmination of 4, actually a little more than 4 years of work that we've been doing in this program. The first thing we did is we looked at what are we actually spending now across the state, and we took 9 health jurisdictions and really dug down. What are you spending now? What are you spending it on? And then we asked the question, so if you're to fund this appropriately, what would that take? And the gap, we extrapolated that across the state. The gap's about a $100 million gap in the state to come up to a minimum set of standards. So what we're
The state
asking,
only gets 25 million?
and all we're asking for right now is 25 million until we can come up with a plan that really looks at in-depth at every health jurisdiction. How much are we spending? What are we spending it on? And what's the appropriate level of spending for what we need to do?
And I didn't mean to giggle, but anytime anybody says, all we need is a 24 million, I can tell.
I know.
All we're asking for.
All we need is 60 in the city.
Yeah.
Well,
So-
when you look at the 100 million vis-a-vis the basic
Yeah.
education funding gap, it's a bargain.
It is. It really is. It is. Budget dust is how Mary Selecki referred to it. So I think it's a reasonable ask, but now it becomes a matter of how do we sell it? How do we, get that to the legislature? How do we talk to our partners as well? Because we have other groups that are reading in this Hospital Association, the Critical Access Hospital Association, all these other partners. are gonna have some say in this, especially because they're asking for money on other issues as well. So on Sunday, Sunday starts the Washington State Public Health Association's annual fall meeting. It's 4 days in Wenatchee. The steering committee is, of which I'm part, is meeting on Sunday evening for the rollout of this plan. So we'll be talking with all our public health associates at the Sunday evening, and then the big public presentation I think is Tuesday morning. So this is the big focus of the Washington State Public Health Association for this year is modernizing of the public health system. So it's going to be an exciting week next week, I think.
So, go ahead. So the areas you are drilling down to are communicable disease, investigation response, and chronic disease.
Kind of as pilots. But those are the things that really we've lost the largest funding on.
Okay, so, but you gave two examples
Mhm.
that are not in here. One's water quality and the other one that you don't think you
So,
shared at this
so,
point, the
so
epidemiology.
the way we've looked at this is each no two health jurisdictions are the same. And this funding would come down in a flexible way. It's not buckets of money that have a lot of strings attached to it. It really is flexible funding for health jurisdictions to fill those gaps. You know, here we do a pretty good job of assessment and health education, but we really have a gap in water quality. I think we certainly need some more support in communicable disease. We have nurses that are leaving, and part of it is low wages. This is not designed to supplant those low wages. This is designed to look at if we need to add more people to a program to deal with communicable disease. I don't think we're simply not ready for anything like a big measles outbreak. We're not ready for an Ebola. We simply don't have the staff for it. Staffing is going to be the big elephant the next several years as far as especially nurses. Nurses is the hardest one. We've asked to commission a study from UW on the public health nursing pipeline, where it's at and why we're not getting nurses coming to us. We've had nursing positions open for 5 months
Yes.
and had one applicant. So what are those barriers out there? Is it funding? Is it the work? Is it the education? What are those things? And hopefully some of this money will go to address those sorts of issues as well.
Okay, well, thank you for your work on that.
I see a question brewing over there.
Yeah, I'm just trying to think of a solution.
Yeah.
I don't have, but,
Do you think that maybe since you've only gotten one application, it may be that they don't want to settle here? And we have issues with our city and our county.
I think there's multiple things. It's because it's not just here.
You're having it all over?
All over the state.
Okay.
Northeast Tri's had two open for months. Garfield County's had 2 open all year. So we're just not getting the nursing. It used to be
For
public
public
health was
health.
the choice nursing position because it wasn't shift work and
Right.
it paid pretty well.
And we got weekends off.
Yeah, you got weekends off, yeah. But I think things have changed over time. And it doesn't look this. I mean, there's some lucrative offers. Northeast Tri lost a nurse. They paid her a $10,000 bonus to leave, and paid her moving expenses to go back east.
Wow.
And plus whatever raises and what. But
what is
Just the signing
qualification?
bonus was
Just an
10,000.
RN, or is it something special we have to have to do?
it's at least an RN, and we prefer BSN. For bachelor's of nursing includes a module of public health.
Department of Health sitting at the table on these discussions?
Absolutely.
Okay. So the 1.9 million came from them?
Mhm.
Okay.
Actually, that money came from Robert Wood Johnson Foundation.
Okay.
So, but through a grant through Department of Health.
So I imagine as you roll it out, you also have to think about, what are the consequences of not having this appropriation, and, the big scary story.
Yeah, and that was my point last Wednesday. As we were talking about this, I said, put my hand up and said, okay, this is not the panacea for everything. What is Plan B if we don't get the money? What does that look like? And that's when the room got really quiet. So, and that's something we need to be able to articulate to our legislators, is what does this look like if we don't get this money? You know, what starts to fall apart? And things will start to fall apart. Maybe not so much here in Mason County. I think we're a little more well-positioned. But in other places in the state, it's going to fall apart. You have some of the health jurisdictions are down to 4 part-time people.
We lost a lot.
And we've lost half our staff.
Yeah.
Who are your champions in the legislature?
Joe Schmick is big on that. Shelley Short is, the one from Tacoma Pierce. Senator Cody is.
Lori Jenkins.
Lori Jenkins, who is a representative, and she's also the Deputy Director of Public Health for Tacoma Pierce Health District. So those are probably the movers and shakers right there.
And this is obviously not a agency request.
No,
No. Information.
right.
No, I meant that you could go to DOH and ask
Oh,
for the question of, are cities, is there some way to bring cities into this? Because they have a really good lobby team.
Yeah, I'm pretty tight with the AWC. I've got some friends on AWC. In fact, when we have legislative day, what we generally do is we piggyback our meetings together. So instead of getting a 15-minute meeting with a legislator, we get a half hour. And that works very well. It's a good technique.
So you said you had information from Diane. Did you, other than that?
Oh, other than that, the other one I wanted to bring out was we had our first Governor's Suicide Action Committee meeting a couple weeks ago. And I thought I would break out some of the data that pertains to Mason County. And I want to talk about that just a little bit. I know this has been a concern for Dr. Yu. We had our health educators put together this piece, and then I went through and took the data and just put it on a graph on the back. And the graph is interesting in that we would have a high, and then like say 12, and then drop to 4. Back up to 13, drop to 4. Up to 10, back down to 4.
Wow.
Until recession hit. And then it evened out at a much higher level, not less than 9.
What are the ages?
This is not age adjusted, this is all ages. But what I'm seeing is a trend towards lower ages. It used to be that you could guarantee that it was males between 50 and 55, women between 45 and 50. Once females got past 50, it dropped off to nearly 0. But now we're starting to trend a lot more in the low 20s.
Is it safe to say there's a connection with mental health? Mental health of these people and suicide?
There's a number of connections and I studied this in detail. In my battalion in the Army, we had one of the highest suicide rates in the Army for a while. And in Northeast Tri, I looked at every death certificate every week to look at trends. And one of the things I've seen is you have a certain amount that are suicides related to future incarceration, courts actions, legal actions was a big influence on suicide rates, especially men in their 40s and 50s.
Who were incarcerated or?
Were facing incarceration.
So they're out on their own recognizance going into sentence.
That was a factor. A lot of what I saw, especially in the older, 50 years and older in males, underlying factors of chronic disease, chronic pain. And a lot of chronic pain was a contributing factor to suicides. So people with stage 4 cancer, you saw those as well.
Who chose not to go into physician-assisted suicide?
Well, that's only been
Yeah.
available how long?
2 years, 3
Yeah.
years, 4 years, no more.
Not that long.
And I don't think I've seen any on the
Well,
desert.
chronic pain isn't a condition for,
No. Right.
or allowing, unless it was
Right.
criminal
Right.
offense.
Right.
So, I mean, there's just any number of those things. What I'm seeing, I'm finding, I call it the Xbox generation. So and this is just a supposition on my part, but it comes from a lot of reading. Is we've got kids out there who've had, I call them helicopter parents. They're Xbox generation. When things go wrong, you hit the reset button, and they've not been allowed to exercise those muscles of failure. And when they're out on their own and relationships start to come apart, and it's always around relationships. The younger ones, it's always around relationships. They don't have the coping mechanisms that they've built and polished over time to deal with those. And I don't have a scientific study I can quote on that, just from my observations and reading.
So I, for one, am glad you're watching it.
And one of the things we're going to do is we're going to start tracking these in a little more detail at the local level and track, method. Because what we get from the state, that doesn't give us the full picture, I don't think. So, and start tracking some more data locally.
You track that through the hospital and the police department?
Well, that's the
Locally?
problem is we don't have the interoperability to do that just yet. So
But mainly through death certificates.
mostly through death
And this
certificates.
probably wouldn't count heroin suicides and stuff like that either.
Right. So
Yeah.
an intentional overdose would just show up as an overdose on
Yeah.
death
Right.
certificate.
And so you don't know whether it was intentional or not.
Right.
So that's the problem. Okay, so I guess we can move on down to discussion of Frank Phillips and the board. Having another board member and who we should replace him with. Any ideas?
So Frank represented the Fire Chiefs Association, it's like, not fire
Correct.
chiefs, the
The fire district. What is the official?
Commissioners.
Commissioners, Fire
Commissioners.
Commissioners Association. And
Yeah.
so, and my assumption is that was chosen because there are fire districts countywide, they're all elected officials, they are representative of a population of people in the district. So, I think the discussion here is that still an appropriate body to go to for representation. I know that we've dealt with this at the Mason Transit level, and we moved from fire districts to school districts. And I think it's worth a discussion to both of those associations. I don't know if there's an association of school board directors here in the
And
county.
because of the way we've done this and we've changed it over the years, there's a possibility that we could offer both.
Yeah, that's what I was
Mm-hmm.
wondering.
It would be nice to have a revolving school board
Mm-hmm.
representative because of their nursing programs, their direct interaction with the kids for educational programs, and I think that the fire districts are still important. So
Yes.
maybe we can consider offering both.
I have a thought that I'd throw out. So I've seen it done when we had cities involved, that we had a rotational schedule. So 1 year was one city, 1 year was the next city. You could do the same thing with school districts and fire as well, and they would have it on a rotational basis.
So that begs the question to some extent. Now, these folks are not elected, but there also is a Emergency Medical Services Council.
Well, I would prefer that stated an elected official
Yeah.
because like
Yeah.
Eileen has no voting. So
Yeah.
then,
And-
when we
and-
need a quorum, it's kind of hard.
And we've given them voting powers, so I
Yeah.
think it's important for them to remain elected as well,
Right.
with voting powers.
So we have the convenience of like I said, an association of fire commissioners.
Right.
So it's one point of communication potentially.
Yeah.
But we don't have that luxury with our school districts. So, I think what that warrants is if we were to add both, we'd make a proposal for what that rotation would look like. Go ahead and set it up, Greatview this year, North Mason the next year, and then, send it out to all of the directors, there's chairs of each of the school boards, aren't there?
Oh, yes.
Yeah,
So
okay.
would you go with Canal,
Yeah,
Pioneer,
every school district in
Southside?
the county, yes.
Okay.
School district.
School, yes, well, Southside's a school district.
Right, yeah.
Right, Pioneer is.
Right. That's what I was thinking, just cover all the school districts.
Mhm.
A letter with a proposed rotation, giving them, of course, the opportunity to select among themselves who among that board of directors they would send forward. See if anybody wants to opt out, or not make that offer in
One
the
year,
letter, but-
one year we'd do one school district, the next year we would do another school district, that type of thing.
Yeah, is 1 year enough continuity, do you think?
I don't think it is.
I don't think it is either, but is there no county-wide school district? No, nothing.
No, and kudos to the North Mason School District for at least opening up discussions and starting their own, at least meetings of school board directors among all this, but there is no organized group.
Well, because of the scope of this, I could see the larger ones. I have a hard time seeing the tinier ones that they only have 300 students or 150 students in order to get the largest impact for the board and to be able to, I see them as being a tool to use to put stuff out through as well.
So
But
maybe it should be more just the high school schools,
that would make more
a
sense to
little
me.
more sense.
School districts that have high schools.
Yeah.
That's 3, right?
If you
North
can-
Mason,
and
Shelton.
Marion Knight, and Shelton.
Yeah, there's.
Yeah.
Marion Knight is very small.
Yeah.
Is it?
They have like 4 graduating seniors,
Oh,
4 or
really?
5.
Yeah,
Yeah.
that's pretty small.
Yeah.
I didn't know they even had a high school.
They do.
Yeah.
Keep wondering how long will that continue?
They're doing great out there, so.
So maybe that would be a better way is to,
I feel like there's full county representation that way,
That
though.
way.
Well, we're not gonna get full county representation.
especially if they're rotating, how could you possibly?
Why? Yeah.
Even for the fire association, doesn't mean you have full county representation. The person may not have any contact with some of those, you know how some of those districts are, they're existent but non-existent.
That's true.
We could give them the option to pass to the next district. If they have somebody who, you know,
They just
they're in a
don't have
position where they
anybody.
have nobody that can attend, they can opt to pass to the next one in the rotation.
And I like the 2-year type rotation, so they have time to,
Actually
Mhm.
figure it out,
I would like that too.
yeah.
sure, it would be nice if we could have them select who they want to represent the school districts, though. That might.
Have the
maybe
school
we-
board decide that?
Yeah, we force them to have their association by having them select somebody to represent them on this
Oh,
board.
oh, definitely.
And it would become
all
someone
of
from their school board?
Oh, all the
I
schools.
mean, all of them.
Um,
Some of them won't be interested at all, some of them might.
Is this
No.
people coming off the school board to serve?
No.
Or somebody in the school district?
Within the school district.
But then you run that same situation that we are with Eileen, where it would, because she's not voting, because she's not a.
Yeah, I think it needs to be a
No.
voted
I thought
school
that-
board
I thought that
member.
was a question.
No, I asked if it's coming right off the school board, or if it's out. You said it would be out. It would just, you wouldn't
No,
decide
yeah, it'd be a,
from the school board.
the school
They
board.
would pick someone that's on the school
That's
board.
on the school board,
Okay.
yes.
Okay, all right, got
Amongst,
that.
in my opinion, to be a voting member, we
You have to
we
be
set it up
elected.
that way, you have to be
Yeah.
elected.
Okay.
Official.
That's how it was set up when we
Yeah.
did this.
Okay.
We can always change it, but that, I kind of agree with it,
Mm.
So,
so I'm hearing, go ahead. I'm
so
sorry.
what I'm wondering is, could you send something out to the schools and the, or do we want just
I think it should just go to the school board.
this?
Right, the chair of the
Right.
school board of
The
each of the
announcement should
schools,
just
or
go to
only
the
of the
school.
schools that have high schools?
That's your question. That's our question. I think just the high schools, because the grade schools go into the high schools. So you're
Mhm.
still representing the grade schools and the middle schools.
Right, the school boards
Personally.
represent all the schools.
Yes.
Mhm.
I don't know that a Pioneer school board director would agree with that.
Don't you think they are somewhat represented with their kids going to the high school? Do they stop at grade school?
Well, then those kids would rep, for Pioneer School District, they go into the Shelton High School. So they
correct.
would be represented by the Shelton School Board.
And that's what I'm saying.
Yeah.
When you think of public health interventions, though, you typically think grade school.
Well, that's
And
true.
at the school level, because I would hesitate to say that the Shelton School Board of Directors
Represents.
would say, yes, we should do that at Pioneer School.
Yeah. I understand where you're coming from.
Madam Chair, we're talking about expansion here. If you don't mind, let's talk about a little bit more expansion. All the schools, districts, one selected from the north, one selected from the south, on a 2-year rotation. Those northern districts will select their representative as a school board member, and the same with the south, and will select their member as a school board member and decide and send forward. And then we still have one for the
So use the Benson Road as the north-south divide. Where would Hood Canal fall?
Hood Canal goes to Shelton, so it would have to, Hood Canal would be south.
And then so it would be incumbent on the school boards, directors of, say, North Mason and Greatview to have discussion among themselves.
And send an applicant, and then we would decide. If there's 2 that has to come forward, we decide. As a body, we'll select who we think is most qualified to be on here, if they can't decide on their own, if there's more than one applicant.
What do you think about drafting a letter for that?
Oh, we can put something together, absolutely. So I understand, we're talking about the fire commissioners
Mhm.
as a group,
Association.
as an association. We're talking North Mason, South Mason, one representative from each, elect, or put forward by those different school boards, elected school board members.
I think that's what we're saying. Do I have a motion? Do we have to have a motion? I think we should have a motion.
Unless we can think of
And
a
it's-
simpler way.
And there's one more thing that we have to consider is whether there's some sort of ordinance or bylaws or something that needs to be changed.
I like the concept of rotation and having someone who's already served be present with somebody new coming in, so you don't start fresh in 2 years. There's an overlap.
So it's like the first one with the stagger.
That's what I'm thinking, because then someone coming in can take the benefit of the learning experience. And so it's that stagger start, so you always have someone with a bit of seasoning, if you will, as another person is coming in to serve.
I didn't get seasoned.
No, you didn't.
I don't think anyone else should. No,
I guess I have had a situation where I had a 9-member board and replaced 7 members.
Yeah.
Yeah.
And how did that go?
And that took almost 2 years to get everyone up to speed.
Yeah.
Mm-hmm.
And then
So-
that changes.
Mhm.
In that staggered scenario, so then would the first term be a 3-year term or a 1-year term?
Well, I
For
think
one of
those are
the
the details,
candidates.
and I think you really want to shorten the learning curve and the repetition, so you're always kind of like Groundhog Day kind of a thing. So if you can always have someone that has, if seasoning doesn't resonate with you, some experience and knows how things work, that can really help someone new entering into, I think that would set the stage for forward movement rather than having to reset everything periodically.
I understand, but I'm just trying to think of the mechanics of that staggering.
Recommendation 2 and 1, 2-year, the first one from the South Mason area, a 2-year rotation. The first one from the North Mason area, 1-year rotation, the 1 year, the first year, but they'll have an opportunity to select that person again, they want it after 1 year to do a 2-year term at that point. They have less to choose from, so the chance of an argument is less. Where the more you have, and such a quick rotation, you have a possibility of some turmoil. It seems simpler that way.
So is it agreed upon? Do we have to?
And we will have to change the part bylaws and
Yes.
stuff, because I know that's not what it says.
So let me try this, and I might have you read back. I would move that board, that our community services director send a letter requesting replacement, send a letter to the fire Commissioner Associations, Mason County Fire Commissioner Association requesting a replacement for Frank Phillips to represent the fire commissioners on board of health. I'll stop there.
Yeah, good place to stop second.
Pardon me?
I'll second. That's a good place to
Okay, all
stop. that.
those in,
Does anybody need to read back on that?
all
That keeps
those
it-
in favor?
Aye.
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 That keeps it real simple so we don't get the
So
all
passed.
confused.
And then I would like to make a motion that the Board of Health, that our community service director be instructed to send a letter. Let me start over.
Draft
I would like to
letter.
make a motion that we expand the Mason County Board of Health membership to include 2 directors, school board directors, one representing school board directors of schools placed in the south end of the county, and one representing school board directors in schools in the north end of the county.
Do you want that director on there? 'Cause
School board
they-
director. That's their name, they're not called school board members, they're called school board directors.
They are. I was under the assumption that there's one director, the rest of the school board. One is like,
That's not how I heard it.
okay.
And maybe each school district has a different way of calling it, but I don't know the Shelton School
Okay.
District calls them school
All
board
right.
directors. Are you a school board director?
I think it's director.
School board.
Yeah.
Works for me because, just clarify, it must be an elected
Mhm.
position.
Okay, so do I hear a second on it?
On a staggering
Oh,
schedule.
I thought that might be a third motion.
Because you're gonna want,
Okay.
don't you want to add it in, instruct them to add it into the bylaws?
What have we got so far, Julie?
For the second one,
Yes.
Commissioner Jeffries moved to expand the membership to include two school board directors, one from the north end and one from the south end.
And that each school board director be selected on staggered terms. South End School Board Director begin their term, a 2-year term upon selection. North End School Board Director representative serve a 1-year term. And thereafter, each school board director representative is selected for a 2-year term. How's that?
And to direct staff to put it up for a bylaw for approval. Second.
Can do.
All those in favor?
Aye.
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 Yeah, it passed.
I think it's a good idea. We've had a problem the last few times with getting a quorum. This will help
Yes,
that a little bit.
hopefully.
Some people that might be willing to. I'd be curious to see who comes out, who really wants to be a part of that. Because to some people, this is a very interesting subject. It really truly is.
Okay, so moving on, other business and board discussion.
We'll talk about the water.
Absolutely. Excuse me.
Let me take a drink of it first.
Yeah. Well, there's nothing wrong with it. Let's start there. We have today experienced a social media firestorm. And it's not only been calls to the health department as such, but to the commissioner's office too. And I didn't realize that until Julie reached out to us. But somewhere on social media, someone picked up the fact that a small public water system in Mason County had E. coli violation. Now, this is a small 14 connection water system up in the North Shore outside of Belfair area. And these people who run the water system are very active on social media. They had pictures of flushing the pipes. They had pictures of their new well house being constructed. It's really kind of cool. But somebody picked up on that. They went to the State Department of Health website that lists, they have announcements. It's called Department of Health Recent Drinking Water Alerts. And they pulled up the alert for this E. coli documentation, saw it said Mason County, and everything that went out on social media was that Mason County has E. coli in the water everywhere. We had people calling from the city of Shelton, people coming into the office. When it is indeed a small public water system that is taking care of it. This happened on September 19th, September 16th, pardon me. They have disinfected their system, flushed it, and are doing all the things they need to do to get their 3 water samples in to make sure everything's good, and then they'll be taken off the list. It happens from time to time. Anybody who's run a water system understands how this goes. But the water system even used social media to contact their customers and tell them about the boil water order. So, you know, it's out there. It's in the world for everybody to see. So we did a news release just to let people know that there is not a huge E. coli issue in Mason County, that it is confined to one water system and they're on top of it basically. This is unfortunate because it came on the heels of all of the news media coverage of the chromium in the water. And so people are sort of uber sensitive to anything to do with their drinking water. The chromium issue wouldn't have been quite so bad if they hadn't called it the chemical of, oh my goodness, Aaron Brockovich, thank you very much. And so immediately it's Love Canal and we're all going to die.
Well, also when we were talking about our well 1 going out this summer, we had people calling the city and people emailing me wondering, when are we going to have water like Flint, Michigan?
Yes.
Yeah.
Yeah, I heard that for a while when all that was going on, and one of the things that I just found it, and one of the things that spurred it is somebody says their mother-in-law has E. coli, and I wonder if that's where it came from. So that's
Oh my goodness.
that's what, and there's others of the defendants saying that's not true. It's,
Yeah.
so this is the Queen Anne
Yes,
one
it
up
is.
on the top, and
Yeah.
Belfair View Estates, Herd Road.
Yes, so you know it well. They have a 40,000 gallon tank that they've chlorinated. Their well is almost 300 feet deep. So
Has anybody gotten sick though that we know of there, or
No.
just found it in the?
they found it in the regular sampling cycle.
And there's a possibility always that they could have taken the sample from a different outlet or something else as well,
That's a
right?
possibility. There's a
Yeah.
possibility that somebody was doing a little bit of work on their own system
Yeah.
and broke the pipe.
Would there be a possibility that this happened to the city years ago with someone climbed to the top of the tank and put some contaminated things into the tank?
Oh, yeah, they were
Mhm.
partying hardy on that tank. I think there were beer bottles and everything in it.
Yeah, so
Yeah.
that, I don't know if that's a possibility,
Mhm.
but.
Yeah, so much smaller area, people are watching, but we just wanted to give you an update and let you know that,
It's good.
you know, that the day took an interesting turn. Everybody had planned what they were going to do, and then several of us didn't get to do any of that stuff because of these issues. Social media is a really powerful force. And hopefully when we need it, when something bad happens, we'll have just as good a response.
I'm old, and I guess when you said really powerful force, I just remember the old Get Smart. If only he used his powers for good instead.
Yeah.
I said that at our management team meeting today too. So anyhow, that's our main update.
Huh.
And there's no public for public comment.
Mhm.
We usually have some public, none today.
I did want to bring up a board discussion item, or just to let people know. Last meeting, we heard from Dr. Yu the plan for opioid epidemic response plan. And one of the actions that I think we were hopeful to be able to take at some point was having this board direct any opioid death or overdose as a reportable incident so that we could have better data collection on that. Dr. Yu did have available at the opioid forum a potential discussion piece on that I don't have with me right now. And she was investigating one piece of it, about whether or not it was something that could be regulated just from the Board of Health or just directly from the public health officer. She still needed to research that. So I do anticipate and I'm hopeful that that topic will come up at least our next meeting. I thought she'd be here today, actually.
Yeah, so maybe you can,
I'll share something about that event too. Very great event, very well done.
very well attended, I thought.
You know, and I don't know if everybody remembers, but you know, I never liked the idea of a methadone clinic or any of that stuff, but I've come to look at it differently. I've been converted by looking at some of the dangers of having nothing, the ability to actually do something about it in our area. As an educational thing, it came up that the reason why it's not a methadone clinic that you look to do first is because it's a federal program, and that's a lot harder to even possibly get done. And the reason why Suboxone is so hard is because in order to do a Suboxone clinic, you also have to have it tied with actual treatments. You can't do one without the other. They have to all be done. So tomorrow night, I am going to a thing with a few of the doctors and some of the mental health agents in order to try and find out what we can do as a county to actually just make this happen, a Suboxone clinic. And, you know, of course, you've been on the forefront on these issues. If you chose that you would rather go, I would step back. I just was in that community, or in that group, and so I think it would be important for one of us to be there, so I volunteered to.
Yeah, if you committed yourself, that's fine, because I probably have a conflict, but I'm also hopeful and have been assured that a staff member of the behavioral health organization will also be there.
No, they will.
Okay.
Them and a few of the others, they're a little bit hesitant about whether to even get involved in it, but they're gonna come and see what can be done. I actually hit them direct because they were standing right there. I said, listen, I know we want to do some tough stuff, you know, with some of our negotiations, but we have a lot of great respect for you. I think it's important that you're there because, you know, we do believe you when you speak, so it'd be nice to have, you know, your opinions. And they're a little hesitant, but they're going to look into it and see what they can do too, because it is necessary for everybody to work together, or it will not happen.
So can you share with us as a board? I wasn't part of that one.
Yeah.
We broke up into different groups.
Yes.
Were you part of the discussion? Susan?
No, I had to leave
I
early.
Yeah.
Why Suboxone over methadone?
Well, one of the reasons was very simple. In order to do a methadone clinic, it has to be a federal program, so you have to get the feds to set everything up. It has to go by all kinds of different guidelines,
And all
it's
the
an act of
federal
Congress.
rules. And you have to be approved by the federal government
Right,
to even
but-
set it up.
But Evergreen Health Services is that provider that is very familiar with that program and would be able to probably do the work that's taken.
So in order to have Suboxone, you have to be a methadone
No.
clinic?
No.
No, you don't.
One has nothing to do with the other. In order to have Suboxone and have that be given out for
You
a
have-
doctor to actually prescribe it, it has to be connected to a true
Treatment
treatment
like
program.
counseling. You
Not
have to
just,
have-
not just, you know, you're clean today and we want to be able to help you, so you come and you get your drug. It's nothing like that, it's different. This is set up with a program where you're going through treatment, and while you're going through treatment, then you can have this in order to offset.
Right, okay, I
Uh,
understand. I remember.
Where
that.
methadone, I guess you just, if you have the federal program, you can get the prescription, you just go keep getting your methadone. Completely different type of setup. And what happened at that meeting is they decided in the very beginning that because it was so onerous and hard to even possibly even make it happen, that was put off to the side,
Okay.
and they focused on this because there was a doctor that was actually sitting there at the table that does it. He actually is a prescriber, like Dr. Yu has the ability to do it, but I guess she has, what'd she say, 7 or
I thought 30 patients.
maybe
You
30,
could.
but she can't do, you know, everything that we would need. This doctor was sitting right there, and he's done it, he did it before.
In four.
Yeah, so here was experience, and then he was honest and saying, listen, it's just not that easy. In order to do it, you gotta have all this, and then the question came to all those around the table, who of you here work with him? Are you willing to get involved? And behavioral health was, well, you don't know, you know, because there's a lot going on. They were very smart about it, the way, that's how I took it. It wasn't just stand off, they were saying, listen, you know, I'm not gonna commit, this is big, this is hard stuff, let's find out. That's what I took her words.
And I've seen the Suboxone done in the jails. Because, you know, one of the problems you have with the jail is you have somebody comes in, then of course they're not using them while they're in the jail, we would hope. But as soon as they come out, that craving hasn't been dealt with, so they were starting that program while they were in the jail, and then they would transition to treatment, through the county mental health program upon release. So that's a way.
But in order for a doctor to sign up to write for the Suboxone, they have to have the treatment part of it with it, so they have to have the mental health counseling to go with it.
So they make the referral for the counseling, and then that referral goes to probably our BHO or
Right.
whoever.
Right.
Or if it's Medicaid paid. If it's
Right.
not Medicaid paid, then I'm not sure. What other insurance companies are doing regarding?
Well,
That's one of the
other
things we were doing
insurance
was-
companies do.
It was part of kind of a comprehensive thing, so as, before their release date, they were signed up for Medicaid, because of course their Medicaid was suspended while they were, incarcerated, but within 1 week prior, they started all the paperwork, so there wasn't a gap when they opened the door.
Right. Well, no, thank you for attending that.
And they're planning on meeting, how often? Was it how many weeks? I know the first one
I
was
think that, look,
6:30 tomorrow night, I
yeah,
know that.
they just agreed on that one. I don't think they actually agreed on how they're
Oh,
gonna do
how
it.
often?
It was because they were so not sure, they said, let's do this one, and we'll see what we can do from
We'll
there.
go from there.
Which, I agree with that. My question, okay, I'm listening to all this stuff, so now I'm just, what do I gotta do? Okay, so let's say we've made the decision, so now what? And that's where we're at.
Okay.
Okay, any other comments? Okay, I will entertain,
Madam Chair, I was supposed to remind my director about the date of the next meeting.
Yes, you were.
oh.
Yes.
So the next meeting
Oh, yeah.
falls on the Tuesday before Thanksgiving.
Oh, no.
My recommendation is we put it off 1 week to the week after
After
Thanksgiving.
Thanksgiving?
It'd be the 29th.
Right.
I don't have my calendar to say whether I'm available, but
I don't know, but I'm actually going on vacation.
Oh, so you will not be.
No, I'll be there, I'll be back then.
okay.
I was
After-
afraid that we'd have a lot of board members who would take the week off of Thanksgiving, and we'd have not have a quorum.
So maybe the week after Thanksgiving would be more appropriate. Fine with me, it doesn't matter.
Again, remember though, we also agreed, sometimes there's times where we may not have anything.
Well, actually, yeah, so it'd be the 29th of November. So Tuesday after Thanksgiving.
Well, we'll have something because we need to know how the schools respond.
Okay, yep, yeah.
We need to know,
There you
yeah.
go.
And I'd like to be able to present what I hope will be a finished budget for the Behavioral Health Organization. I do want to announce to anybody interested that they are meeting, the governance group of the Behavioral Health Organization is meeting here in this room October 7th at, I believe, 1:30 to look at the budget for 2017. It's biennial budget, 2017-2018. And it'll be a pretty substantive meeting in that there's a pretty healthy reserve in the Behavioral Health Organization. There's a constant threat that those monies will be swept by the legislature, so there will be some serious discussions about how to use those monies.
Do you know how
And
much
maybe
there
it's-
is?
Pardon me?
Do you know how much that is?
I don't know what it sits at now, but it's over 5 million. So, and I'm not going to pretend to understand why, but there is an increase in monies available of Medicaid funded services due to some sort of formula that came from the federal government. So this is definitely an opportunity to be addressing behavioral health issues locally and being able to capture some of those monies here for this community, which previously had not been available for this community. And so, I would love to have some folks there just to hear if you're available and/or make some suggestions. Right now, I'm kind of focused on a mental health triage center and maybe a detox center down the line. But things like Suboxone, clinic. I'd love to have some interaction, some more meaningful interaction with our jail population. And we've been in a transition in leadership there, so it's been difficult to kind of say, you know, we're going to do this with the jail until you've got the a jail chief here to go, yeah, let's do that.
I'd like to clarify a little some, you know, on this thing when I was saying, if she's interested, I'll get it back. I'm old school, and right now we've had some incredible things that are happening right now in this arena that Commissioner Jeffries has been championing moving forward. Being old school, if somebody's doing it and it's working well, you step out of the way and empower them to get done what they're doing. I'm not jumping away from things. That's not what it is. I'm trying to empower something that I see. I'm telling you as a commissioner, I'm seeing some really big stuff starting to generate out of this thing. So I'm not trying to run away. I'm just trying to make that snowball bigger.
This is tomorrow night?
This is tomorrow night, yeah.
Wednesday night at 6:30.
If you'd like, I could probably
Either way,
my plans.
you decide, and then I can do what I'm going to do. And
Okay.
but I definitely don't want to leave it out there and leave it open because I think one of us should be there. But I'm just trying to step out of the way so you can
Okay.
do what you're doing and use me for support. It seems a lot smarter that way than to have two of us kicking indoors.
Okay, let me check my schedule. I have a Community Action Council board meeting and
We have a meeting tonight, so
Okay.
you can tell me at that time.
Will do, okay.
Okay, any other discussion? Okay, I entertain a motion to adjourn.
Motion to adjourn. Move for adjournment.
Second. Oh, all in favor?
We
Aye.
are.
I just want you to know that when I was doing from the desk of the environmental health manager, as Dave wanted us to do, he came in, he looked at it, and he said,